working in healthcare field, so just let me know, yes or no. So I think um, mm, uh, are you able to answer the poll? Because I saw that. Are you currently preparing for the CPHQ examination conducted by NHQ? Now, are you able to uh, give a selection? Just let me know, because I don't see that uh, we are able to do that. Okay. Okay, fine. So are you currently, I can't see the result. So my team can tell me what percentage it is. Yeah. Maybe you can make me the co-host as well. Okay. Yeah. Okay, thank you. So planning in future, most of you are telling you're planning in future. Very few are appearing for the examination. What is your role in your organization? If you can just let us know. So I see that lots of people are, mostly people are nurses and doctors, technicians as well. Students also are there, and administration as well. Administration also, we have got some people. Okay, so thanks for answering this question, because that will give me an idea which type of examples I should be taking. And yes, so today I'll be introducing you to what is CPHQ examination, and also today I'll be training you in two topics or two or three topics, basic topics. And one of the things which is most important, the data analytics part, I'll spend a little bit more time, data analytics and process excellence. I'll spend more time on that. So you can see here, a lot of people are time constraints is the biggest, people are telling the biggest challenge in healthcare quality. Okay. Most of the people are saying that. Okay. Some people are talking about second most important votes are for poor data collection or analysis, lack of clear KPIs. Okay. Okay. Okay, thank you. And yeah. Is there, Shrikant is asking that, is there a correlation with Six Sigma? Yes. So Six Sigma is part of CPHQ, but not fully. There are a lot of other topics also, which are part. And it appears that you have attended our Six Sigma programs. So yes, if you have attended our Green Belt and Black Belt, you are a Black Belt certified. And you know, our Lean Six Sigma Black Belt certification passing rate is 100%. So if you have undergone that course, CPHQ becomes very easy for you. Yeah. Okay. So now let us close the polls. And today you will be getting introduced to CPHQ, and also you will be getting introduced to CHQE certification. CPHQ, what is it? I'll tell you in a short while. CHQE is, if you attend the CPHQ preparation program, then just attending the training enables you to get a CHQE certificate, Certified Healthcare Quality Expert. But when you write the examination conducted by NAHQ, then you become CPHQ certified. Okay, so thanks for joining in, and let me welcome you. And this is my brief introduction. I will start with that. And with the introduction of company.
Hi, welcome to Anexas. Anexas has been consulting and training the professionals in the organizations around the world since 2006, and we have trained more than 150,000 people and consulted for more than 500 organizations, which includes Fortune 100 organizations too. I'm Amitabh Saxena, and I have designed this program based on my 30 years of experience while working in various industries across many domains. The whole Anexas team once again joins me in welcoming you.
So we are supported by around 50 more people located around the world and 200 more partners. who are doing great work in terms of healthcare quality across the hospitals in almost all continents. Now I'll tell you about, so there are what we'll be covering today. We'll tell you what is CPHQ, and then I will talk about data analytics because that's the most difficult module or lesson which people find it, or generally I'd say people fail in that particular module. So I'll cover that today. I'll cover some basic statistics, data analytics tools and techniques, and then some project examples I'll be showing you. And if time permits, maybe two projects. And if there are some questions, I'll be happy to answer those questions. So it's a 2-hour program, and I'll try to spend around 1 hour, 45 minutes on teaching, and then after that, I'll spend some good time on either sharing case studies or answering your questions. Yeah, some people are asking about my introduction, so let me give that also. About the organization, we have been enabling individuals and organizations achieve excellence since 2006. And for almost 2 decades, we are involved here. We are very well known for our CPHQ certification training programs and Lean and Six Sigma and project management PMP training programs with 100% success rate of Lean and Six Sigma certification courses and almost 92 plus percentage of success rate of CPHQ in the last 12 years. We are very well known in Middle East and US for our great CPHQ training programs and also the passing rates. These are some of the photographs just to prove that we have been doing training programs worldwide. I also take pride in telling, I'm Amitabh Saxena. I take pride in telling that I conducted the first ever Lean and Six Sigma Black Belt training program in whole of Middle East. And incidentally, that was for a hospital in Riyadh. King Khalid Eye Specialist Hospital had organized that training. And that was in 2007. And many quality directors of that hospital had attended it. Similarly, we have got multiple hospitals in Europe, National Healthcare Service in UK, Australian National Healthcare Service, and Medicaid, as it is known as in Australia, and lots of hospitals in Japan and China, and even Thailand. Multiple hospitals, multiple clients across the world, won some awards also in different forums. I've conducted lots of, more than I think 5,000 doctors and nurses from Ministry of Health in Saudi Arabia, and National Healthcare Service. Here is an example where every project, see, once you become a CPHQ, you learn lots of tools and techniques to improve the processes in your hospital. One of the technique used, and it's also taught very briefly in CPHQ also, is Lean Six Sigma. And we are expert in Lean Six Sigma as well. It's a separate service we offer. You can just see in National Healthcare Service how this individual is talking about the success he has achieved. As we conducted the quality training for them, we certified them as green belts and black belts, and then they did some improvement projects that saves millions of pounds for them. So here is one of the credentials.
Well, we have Alex with us, and he has done excellent Lean and Six Sigma projects in National Healthcare Service and in hospitals. So, Alex, would you like to tell us something about it?
Hello, I'm Alex Wells, Head of Service Improvements at the Royal Liverpool University Hospital. I've been really fortunate to present today on how us as a trust are using Lean and Six Sigma principles to deliver better care for our patients. I've presented today on a lot of the work that we've done around how we've improved patient outcomes, reducing mortality, improving length of stay, and also talked about how we can actually realise some financial benefits from that. Over the past 2 years, we've been really fortunate that we've done some good work, and it's actually delivered us £2 million worth of quality efficiencies through delivering better patient care.
And we have got a lot of CPHQ professionals also talking about our excellent quality.
Mr. Andrew Robertson,
training. I'll not spend too much time. Appear in TV shows also, a Z Business show for our services.
I am Shekhar Sumit.
I'll not spend time on that. American Society of Quality, I've been presenting for the last 8 years. And last year I had presented in how to reduce the nosocomial infection or hospital-acquired infections using the statistical tools and techniques, which is, of course, part of the CPHQ syllabus. Deputy Health Minister Dr. Tarif Alama and also Dr. Muhammad Abdul Ali, who is the Deputy Health Minister of Saudi Arabia. They have also attended our training programs, and many hospitals.
Just finished the
King like Sultan Qaboos University Hospital in Oman, Sidr Hospital in Qatar, King Fahd Medical City in Saudi Arabia, and Cleveland's Clinic, and John Hopkins, etc. They have been our multiple international medical center. Many means we have got a very long list of hospitals where I have conducted the training programs. Okay, so with that round of introduction, I hope now people have joined it. And we are just waiting for some more people to join in. And I think now everyone is in almost. And let us start understanding what is CPHQ first. So CPHQ is an exam conducted by NAHQ, which is National Association for Healthcare Quality. And approximately at given point of time, 19,000 healthcare quality professionals are working and they are certified as CPHQ. Although in total, around 50,000 professionals have been certified till date, but sometimes some professionals after becoming CPHQ, they don't renew their certificate because every 2 years they have to renew the certificate without appearing for any exam. But some fee is involved, and just you can extend your certificate. So some professionals don't choose to renew, but that's why at given point of time, around 19,000, 17 to 19,000 is a floating number, which you have any CPHQ certified professionals at any given point of time. Now, we are proud to tell you that out of 50,000 approximately certified people till date, since its inception, we have contributed to more than 7,000 CPHQ certified professionals. And as I was mentioning, our passing rate is very, very high, and 90+%. The last 6 months, it has been very, very high, 97%, but we can't say what happens in last 6 months is going to happen every time. But overall average is 93+%, and that's why we are proud of it. Now, I'll not go into too much of details of what CPHQ is, what is CPHQ examination, because the purpose, you can always write to us if you want to have more details, but a very quick overview, and very quickly I'll go through the slides. There are 140 questions in the exam. Out of that, 125 questions are scoring. Means 15 questions are pre-test questions, means they will not score you on those 15 questions, but you don't know which are these 15 questions. So you have to answer all the 140 questions. So you have to answer 140 questions. And that's one of the trick, those who are appearing, some people were telling that they're appearing for the exam very soon. The trick is don't spend more than 2 minutes on every question. Because if you are taking more than 2 minutes on every question, that means probably that question is the difficult one, and which is a pre-test question. Anyway, you're not going to get any score on it. So better drop that question. So don't spend more than 2 minutes on any question. If you're getting the answer, well and good, write the answer. If you're not, just park it and come back to that question if you have time towards the end. But better to answer all the questions which you are comfortable about or you're sure about. So this is what I just wanted to talk very briefly. And of course, you have 3 hours to complete the examination, and it is a multiple choice question. They don't tell you whether there's a negative marking or not, but most probably the negative marking is not there, and that is our guess. They don't tell anything, so we are not sure about that part. But given the so much of experience which we had, and what feedback people have given to us, if you're a little bit sure, 50-60% sure about the particular option as the right answer, go ahead and mark it. But if you are totally ignorant, or totally you don't know anything about this question, better you leave that question. Okay. So, yeah, if you pass the examination, you will get CPHQ certificate, which is a very, very prestigious certificate. And if you attend our training program, only attend the training program, you will get a certificate of certified healthcare quality expert. So after the certified healthcare quality expert, once you attend the training, you get it. After that, you write the exam and you will become a CPHQ as well. Okay, so I think it will be a good idea to take you through all give you an overview of the different modules which are covered. There are 7 modules covered. Every module has got some specific number of questions. So quality leadership and integration module has got 19 questions. Okay. Okay. Yeah. Quality leadership and integration is the first say module, and in the first module, it is broken up into 2 parts: strategic planning and stakeholder engagement. Now, it is believed in quality that if you want to improve something, it's better to improve it using projects. What is the definition of a project? Project is something which is one-time endeavor. As against the process, there's a difference between project and a process. In process is something which you repeat. It is a set of activities which you can repeat. You keep repeating over a period of time. Anything you are repeating again and again is a process. And project is something which is one-time endeavor. So, for example, treating a patient is a process. Performing a surgery is a process because you keep doing the same thing again and again. Registering a patient is a process. So whatever you're doing again and again, following the same steps, is known as process. And what is a project? Project is something which is done only once, I would say once in the history of the world. Means something which had never happened and for something which will never happen again. So that is what we call it as project. So now, let me tell you, how to improve the processes in our organizations, hospitals, clinics, labs, by doing improvement projects. And this is what you have to convince the leadership of the organization. So as a CPHQ professional, as a quality professional, as a healthcare quality professional, you are involved in ensuring that quality becomes a strategic priority in your organization. Strategic planning means, every organization has a vision. They want to achieve something. Let's say one hospital would like to become #1 pediatric hospital in the city. Now, this hospital, which wants to become #1 pediatric hospital in the city, that is their vision. And vision, to achieve that vision, you create some strategy. You have strategies means, how would you do that? How would you become #1? So you create strategies. There are many ways of becoming #1, either serving the most number of patients or getting the latest equipment, best equipment in the city, or getting the best people available, best staff available within the city or maybe within the country. So there could be many strategies to become #1. And what strategy you choose, what way what path you take up, that becomes a strategy. So this strategic planning, when the organization making strategic plan, quality should be integrated into that. And this is one of the primary role of healthcare professional. So you would be advising the leadership on organizational improvement opportunities and converting them into projects. See, if you want, let's say, opportunities there to, I'll just take simple example, reducing the waiting time. There's an opportunity. You will take up an improvement project. The waiting time today is 30 minutes, and you would like to reduce it to less than 10 minutes. okay, nosocomial infection or hospital-acquired infections are at X%, you would like to reduce it to X, maybe reduce it by 30% or 50% or 90%. So this becomes a project. Then there are multiple opportunities of improvement in any given setup, but you have to establish the priorities. Which project is more important than the others? You will choose. Participating in activities that support the quality governance infrastructure, you will be creating an infrastructure, quality infrastructure, and how to create this is covered in this part. Aligning the quality and safety activities with the strategic goals. These are the topics which are coming under strategic plan. In stakeholder engagement, you have to also engage the people, engage the senior leadership, engage the middle management, and also the ground force. Everyone should be aligned with the vision of the hospital. Not only they should be aligned with the vision of the hospital, but also they should be participating, they should be engaged. So all of them should together strive to become, if I'm taking the same example, all of them should strive to become number one pediatric hospital within the city. So how would you engage? Identifying the resources needed to improve the quality, assessing the organization's culture. Culture means the word culture is coming from the word cult. Cult means group. So what is the specific behavior of the group? How would you improve the organization's culture? Organization culture means, the behavior, typical behavior of the people working in that organization. Say, for example, if you are, if you go to a particular hospital, you'll find all staff are behaving in a particular way. Now, this behavior they have developed over a period of time, and which we can call it as a culture. How to improve the culture of the quality? How to ensure that the quality culture is imbibed within the hospital culture? And what are the things you need to do? How it would be like, providing consultative support to the governing body, and also promoting engagement and interprofessional teamwork, training the people, and also doing road shows about your work. So all these things are covered in the section B. So this part takes care of the quality leadership and integration, and 19 questions are going to appear. Then you have quality review and accountability, 16 questions, where you learn how to apply standards, best practices, and other information from the quality related organizations. Also, you evaluate the compliance with the internal and external requirements for clinical practice guidelines, pathways, and outcomes, quality-based payment programs. And if you are appearing, there are two ways of appearing for CPHQ examination. One is as a US persons residing in US, and another is international, means persons who are not residing in US. So most of you, this program is mostly, most of the people, I'm not sure anyone from US is joining. Given the time zone, I think most of you are not from US. So I will be focusing on the examination which is conducted for the international candidates. International candidates mean not non-US candidates. So if you are from US, you are from US, then you need to know some different, the institutes in US, different bodies in US, which are influencing the healthcare quality in US. And if you're not, then you don't have to really go into the details, but you should be aware of. So this part, the quality review and accountability, talks more about that. It talks about the documentation required to fulfill those requirements of the government and also the accreditation bodies, practitioner performance evaluation, patient experience, identification of reportable events, etc., and how to maintain the confidentiality and importance of maintaining the confidentiality of performance and other records, plus implementing and evaluating the quality initiatives that impact the reimbursement, because most of the countries and the governments of the countries, they support the healthcare system by providing reimbursements based on the quality of the service provided, healthcare service provided by the institutions, hospitals, and clinics. So, and please keep asking me questions. If you have any questions, I hope you are with me till now. Patient safety. So there are 18 questions, and most of you, I find, most of you, if you have worked in hospital setup, you are more or less aware of the patient safety related topics. And we don't see anyone failing in this particular module. It's pretty easy topic. And we do cover the points given here. And we also cover a very, very important tool called FMEA, Failure Modes and Effects Analysis. Now, I don't have so much of time today to teach you FMEA, Failure Modes and Effects Analysis, but do watch my video, which my team will be putting in here in the chat box. And you can just download that link. Please watch that FMEA video, Failure Modes and Effects Analysis, very, very important tool used in healthcare quality. And this particular tool is so important and recommended by many accreditation bodies that you can always use it right away. Next week also you can do an FME and improve your process. So this particular chat in the chat box, I'll be sending you the link. And actually this video has been watched by more than 1.8 million people. So please do watch. It is pretty good comprehensive video giving in detail how to do a FMEA using a simple day-to-day life example. So please watch this. This is in the chat box. My team has put that video. So that will then we have regulatory and accreditation. These are the 8 questions, which is related to like JCI accreditation, or if you are from Saudi Arabia, Sabahi, or India, NABH, etc. So it depends. They will never ask you any specific questions related to any certifying bodies, but the whole certification process you need to know, and you need to support the whole accreditation process. So there is difference between accreditation and certification. Certification is for individuals, and accreditations are for the organizations. So you will know how to evaluate the appropriate accreditation and recognition options, and promoting awareness of statutory and regulatory requirements within the organization, and also be always ready to be surveyed by the assessors. So this part deals with regulatory and accreditation. Then you have 27 questions being asked in this module of performance and process improvement. So here you will have lots of learning where you know how to implement the quality improvement training in the organization, communicating the quality improvement information within the organization, how to establish the teams. Because when you do the projects, and I did tell you, some of you joined a little late, so you might have missed out, but I'm repeating, the best way to improve any process, the best way to improve anything in the hospital is by doing improvement projects. And project has got a starting point and an end point. The project has got, it's a one-time endeavor. So a typical project will have an end date also. By 31st August, we would reduce the waiting time from 30 minutes to 15 minutes. That's an example of a project. So you are doing projects, and projects are always done in teams. And you'll also learn some different techniques like Lean, PDSA, Six Sigma, and also learn a lot of quality tools and techniques like fishbone diagram, FMEA, process maps. Again, FMEA, but earlier also in patient safety you learn, and this again in the process improvement also you learn. Similarly, lots of ways to evaluate the team effectiveness, and also evaluating the performance of you as a professional driving these projects. Then we have healthcare data analytics, 26 questions. 26 questions, so how to manage the data, assisting in evaluating and developing the data management system, then also designing data collection plans. Now, these two modules, like the one previous one and this one, data analytics plus the previous one, process improvement methodologies. This has around 50, I think 26 to 27, so almost you can say 53 questions, right? So 53 questions out of 125 is quite a huge chunk. So that is why we emphasize on these two chapters or more. And today also I'll be spending a lot of time. So today I'll spend almost 1 hour, 15 minutes on these two modules. I'll be introducing you to these modules, some of the basic concepts which are very useful. So even though you're not appearing for CPHQ examination, it's not mandatory. It's not going to harm you to learn some excellent tools and techniques which can improve your processes. And yeah, I do agree that I see some of you have been who have attended our Lean Six Sigma program. Special welcome to everyone who has attended that. And similar, these two, healthcare data analytics and the previous one, performance and process improvement, exactly what you learned in Six Sigma. So as I said, 50% of your work is already done if you are certified from us. But we don't assume that you have attended our program when you join our CPHQ course. We start from ground zero, and we do teach all the tools and techniques which are required to pass the examination. So here you learn a lot of things like, what is mean, median, mode, standard deviation, correlation, regression, etc. And how to display the data, how to collect the data, how to analyze the data. Today, I'm going to show you. Today, it's more like an introduction program. So I'll be demonstrating you certain tools, techniques. But when you join the class, we'll do it together so that you also understand how it is done and you also become a master. You'll also learn statistical process control tools, control charts, and what is common cause and special cause. A lot of questions are being asked from control charts related stuff, and also how to interpret the data to support the decision making. The best decisions are made using data. As Deming used to say, in God we trust, rest others bring data. So everything has to be data oriented, and we'll understand the importance of the data. Then we have population health and care transition, which is a new module introduced in 2023, just 2 years ago. And here, you as a quality professional, how you can contribute to the overall health of the society, overall health of the population in your city or in your country. So these topics deal with those aspects. So that was a brief overview of what CPHQ is and what are the modules. 7 modules, and we prepare you module by module in detail. You don't have to attend any other, let's say, you don't have to study any other book. Although we provide you all the books, the reference books when you join our training programs, we also give you some good examples of projects, and then also mock exams, a lot of questions. We solve some questions in the classroom, and many questions we give it to you along with the answers, which you can do the practice yourself. So this ensures that you definitely pass the examination. Okay, so let me talk about the organizational leadership a little bit. What is systems thinking? Maybe I'll talk about the first topic, that is systems thinking. This being a very, very introductory program, it is more like introducing you to certain concepts, very, very brief. I would have loved to talk about change management, but today let me talk about systems thinking, because it's directly linked with the data analytics and the process improvement, which are very, very important topics. I have spoken about change management in separate session, and there is a very, very good change management video. In fact, two change management videos, which are there in our YouTube channel. So please do subscribe to Anexas YouTube channel, and you can get hold of a lot of videos. The video, this particular program is also being recorded, and this video is also available in our Anexas YouTube channel. So just feel free to subscribe to the channel and get access to many more healthcare related material, especially process improvement and process excellence related material. So let me start with the system thinking. Now, Dr. Deming, he was a quality guru, and he told that one of his famous sayings is that in God we trust, rest others bring data. What do we mean by that? He says that I'm not going to trust you unless you show me the data. So everything has to be data oriented. You will not make a decision without the data. Okay. So what do you mean by that? Okay. Let me ask you a question. Can you tell me any one thing? Yeah. Just tell me any one thing which so before I go to the systems thinking, let me talk about why data is important, why database, what is the difference between making a decision based on intuition and decision based on the data. So can you tell me any one thing which you would like to improve in your hospital? Any one thing. And you can interact, you can write in the chat box, and I'll pick up any one thing. Yeah, I'll name you as well if you are, if you don't want to name, I will not name also. Yes. So, so here, so many of you have written patient care. Now, see, patient care has got multiple measures. Okay, multiple measures. So let's talk about the measures like KPIs. What you would like to improve? So dispensing, obviously dispensing, waiting time, Hadil is telling, and obviously, yeah, improve patient medication, like dispensing, is dispensing time. Medicine dispensing time, okay. I've done a very good project, not I mean, person trained by me. And when they do this, yes, yeah, I've done it. So I will show you if time permits. Towards the end, I'll show you. I'm not promising you, but a very good project. So let's say, uh, medicine dispensing time. Now there is interest in being a pharmacist. She's telling that I'm interested in medicine dispensing time. So let us say medicine dispensing time. Medicine. I don't know if you are able to read. I'll just make a little bit. Medicine. I'll just write it one more time. I'll write it outside. Medicine dispensing time. Dispensing time. Okay. Yes, medicine dispensing time. Now, if I ask a person who works in operations in the process, they'll say, well, we have shortage of staff, we have this, we have multiple things they'll say. And everyone will probably tell you a different story. But what is data-oriented decision making? Usually, whatever we want to improve, we can designate it as Y. Y means the output. We call it output. Okay. And the factors which are influencing our the Y, the output, here, which is medicine dispensing time. Can you tell me what are the factors? We'll call them X factors. Can you tell me what are the factors which are influencing the medicine dispensing time? Give me some reasons. And then shortage of staff, Chori Lito is telling, Angula is telling shortage of staff. Okay. Shortage of staff. Okay. And yes. Okay. Now, system delays. HIM is down. Okay. HIM is down. Okay. Hospital information management system. Staff patient ratio. Lack of medicine. No medicine. Yeah. Medicine or lack of medicine. Okay. Or change of shift. Change of shift. Okay. And so on. So many of them. Like now people have listed lots of things like equipment, barcode, machine issues, communication gap, etc. Abdur is talking about that. Now let us choose any two. I'll choose two, any two, and we'll see what do we mean by data-oriented decision making. As a certified quality professional, you would always assist the hospital in making data-oriented decision. You'll see why you'll be so right and how you'll protect the hospital from making a wrong decision. You'll prevent the hospital from making a wrong decision. You'll prevent the leadership from making the wrong decision. So let's say, if I take example of, let's say I'll take any two, let's say shortage of staff and maybe change of shift. Yeah. Let's examine these two. A shortage of staff, I will say, okay, we think shortage of staff is the problem. Well, let us test it. Let us test. We call it as testing a hypothesis. Okay. Testing a hypothesis. So a scientific investigation is always, it gives equal chance to both possibilities. So what is the possibility? One possibility is that shortage of staff is responsible for delayed medicine dispensing time. That is one possibility. No, what is the other possibility? Shortage of staff is not responsible for medicine dispensing time. As simple as that. And I hope I've taken the very difficult topic in the beginning. Right now, data analytics, I'm trying to explain something very, very difficult concept. Yeah. And just keep telling me you are with me or not. If I'm, see, today being an introduction, sometimes, I feel I should have taken a very, very simple topic, etc. But I've entered into the most difficult topic of data analytics. I've started with that. Later on, don't worry. Most of the topics are not so difficult. There are other very, very easy topics. But I have just entered into a very, very tough topic. So because it will help you. It will also help you to sometimes learn some new concepts, which you might or not. Because if I talk about patient safety, most of you are aware of. If I talk about leadership, generally, many of you are aware of those concepts. But these are the concepts which most of the people are not aware. And these are the concepts which carry more than 50, 60% of the questions. That is why I'm emphasizing that. Okay, so now, Dr. Satyajyoti, hi, good evening. Good evening. You have been also our past participants of our other programs. So thank you for joining. So let me test it. Let me test. So staff and medicine dispensing. Medicine dispensing time. And number of staff attendance. And I'm just taking some numbers, okay. Number of staff, let's say total staff, pharmacy staff are included, all people involved. Number of staff is 10. Medicine dispensing time is, let us say, 10 minutes. Yeah, this is in minutes. Okay. Number of staff, one day I collected the data. It was 8. Medicine dispensing time was 14 minutes. One fine day, we had staff as 7. Medicine dispensing time was, say, 17 minutes. One fine day, very low staff was there, 5, medicine dispensing time was 20. And one day, it was a very, very bad day, only 3 staff turned up. It happened so. And there was 25 minutes. So average medicine dispensing time. Now, if I plot the data, okay, if I plot the data, the y and x axis, okay, this is the medicine dispensing time, and this is staff. As the staff increases at 3 staff, what was it? This was the medicine. Staff at 5, this is 3, this is 5. It was, let's say, a little less, 20. At 7, it was 17. At 8, at somewhere 8, it was 14. So this is the situation. What do you call this? What do you feel looking at this data? Even without the graph also, you would have noticed as the number of staff is decreasing, your medicine dispensing time is increasing. So do you think, and based on this data, what do you think? Staff number is impacting, staff number is one of the root causes. Lack of staff is one of the root causes of high medicine dispensing time. Yes or no? Yeah. So you can keep replying to me. Yeah. So thank you, Nadira, for Seema and Abdul for responding. Thank you. Madhavi, Rabia. Yes. Okay. Thank you. So that means, yes, that is the root cause. So you would say, yes, we need to, if we either we increase the staff or we train the staff, upskill the staff, either way. But staff is important, right? Right? And just now, what you saw is known as scatter plot. Scatter plot means you're plotting the numbers, one on x-axis, one on y-axis. And when we have got, these are numbers, right? This we call it as continuous data, continuous quantitative data, we call it. Both are quantitative data. Then we make a scatter. Yeah. And when, if this is increasing, one is increasing and another thing is decreasing, we call it as negative correlation. We call it as negative correlation. And another example of opposite correlation would be, another example I'm taking, let's say age and experience. Yeah. Or if I can just make it this way, experience and age. As the age increases, experience increases. I could have done experience versus salary. As the experience increases, salary increases. These are all known as positive relations. Positive means both of them are increasing. If one is increasing, they are going in the same direction. Age is increasing, experience is increasing. Experience is decreasing, like the decreasing in the sense, experience, low experience means low age. Age is less. So both are traveling in the same direction. It's a positive relation. And both are traveling in the opposite direction. It's negative relation. Okay, so this is, we call it a scatter plot. Now we are using data-oriented decision. Yeah. So here, now coming back to our question, staff is important. Staff is actually root cause. Now let us change the data a little. And I'm now going to change the data. Okay. Let us say now I will change the data. Let me, now the data is not the medicine dispensing. I'm changing now. This is, as staff was 10, dispensing time was 20. Staff was 8, dispensing time was 12 minutes. Staff was 7, dispensing time was 25 minutes. Staff was 5, dispensing time was 10 minutes. Staff was 3, but dispensing time was, let us say 15 minutes. Okay. Now, if I plot this data, the same data. Now here dispensing time. Now the data in green I'm plotting. And the staff. So as a staff, 3 is how much? 15 minutes. Then, so as I increase, you see, 10, 25, 12, 20. Do you see any relationship between the number of staff and the medicine dispensing time? Do you think staff is the real root cause of the high medicine dispensing times, or something else is the root cause, or something else is affecting more? What do you think? Is there any relation between staff and dispensing time here? What do you think? Or something else is more responsible? Something else, yes. Yes, Abdul, yeah, you're right. Something else, but not the staff. Something else is there. What is it, something else? Let's say, now, let me explore. We were telling change of shift, let's say. So when I change of shift. Yeah. Sorry, I'm hurriedly if I'm writing. So, because I'm also aware of the time, so I'll try to. So change of shift. Now, change of shift means, here there was a change of shift. I'll just say yes. And I was taking 20 minutes. I'm now going with a green one. There was no change of shift. 12 minutes. There was change of shift. 25 minutes. There was no change of shift. 10 minutes. There was change of shift. 10 minutes. Now, please understand, change of shift. See, medicine dispensing time, like 10 minutes, 14 minutes, is quantitative data, also called as continuous data. Yeah. But change of shift, yes or no, is qualitative data, categorical data, also known as attribute data. Attributed. Yeah. Are you getting it? Now, this is scientific investigation. Again, we have both hypotheses. See, hypothesis, we have to give equal chance to both possibilities. Earlier also, we gave an equal chance. Staff affecting or not affecting, we don't know. Let the data prove it. Now, let us see. Is change of shift is responsible? Someone is telling, yes, of course, responsible. Let us see. I don't trust you. I only trust the data. That's what Deming said, right? I'm not saying Deming. Quality Guru. He said that. And now let us draw the chart. Now here I will not be drawing. See, please remember, when both the data were quantitative, like dispensing time, staff, etc., age, experience, we drew the scatter plot. But now I cannot make scatter plot. The data is attribute. This is a qualitative data. This is quantitative data. Or attribute. Qualitative means attribute data. And this is the continuous. We also call it continuous data, quantitative data. I cannot make scatter plot. I have got another plot for that, which is known as box plot. I'll not go into the details of that right now, because we are just getting introduced to these. But there are many questions related to these charts in the CPHQ examination. But as long as you understand, see, we make you understand the concepts. Once you understand the concept, don't have to even write too many mock exams. Just understand the concept and you can create hundreds of questions out of it. Okay, now let me draw our chart here. So I'm now drawing a chart between dispensing time and change of shift. Change of shift. Change of shift. I hope my screen, I hope, should I make screen a little bigger, or this fine? You are able to read whatever. Am I audible? I see. Yeah, it's fine. Yes. So change of shift, right? Change of shift. Yes or no? Yeah, change of, oh, some people are telling make it bigger. Okay, I'll just, okay, so I'll make it bigger in short. So when it is yes, you see, yes, it is high. Whenever it is yes, it's high. When it is no, it is low. You see? And we generally depict it as box plot. Box plot looks like this, something like this. Let me draw that box. Box plot looks like this. So when it is no, the dispensing time is less. When it is high, the dispensing. So box plot. We drew box plot. So now you don't have to draw any chart in the examination. I'm drawing for you so that you understand it. But box plot will be given to you. They will ask you question. A box plot shows between dispensing time and change of shift. What do you think? What is the conclusion? Change of shift is really a root cause of your problem? Yes, no, cannot say, or this is irrelevant question, whatever. There will give you four options. And your answer would be, yes, change of shift is a root cause. Why? Because when it is yes, dispensing time is high. So they will not show you this data. They'll show you the graph. Okay. And then you have to conclude. Now, unless you understand the graph, you can't answer. Second part, there's no need to solve so many mock questions. I can create 20 mock questions out of it. Instead of dispensing time and change of shift, I can say waiting time of patient and gender. Gender is attribute data, right? Gender, male, female. I want to test whether males have to wait more than females. I want to test it. Again, it will be a box plot. So here I could say this waiting time and gender, or medicine dispensing time and clinic and clinics, right? Spinal, so many like orthopedics departments, etc. Clinic wise, if I want clinic is attribute data, qualitative, I'll do a box plot, right? So you have understood these two concepts, right? And let me show you one more thing. Like if the data was like this one and this one, let us consider this data. In that case, the graph will look something like this. Yes, no. Shift change is there or not there. There's no relationship. With yes, I get 10. With no, I also get a 14. With yes, I get 17. No, I get 20. There's no relationship. With yes, also I'm getting range of values, similar range of values. No, also when change of shift is not there, still I'm getting. So shift change is not responsible. So here, in this case, I will say shift change is not the root cause, but staff is the root cause. Yeah. But in the other case, if the data was looking like the other range, I'll say yes, change of shift is the root cause, but staff is not. As simple as that. 30, 40, 50 samples will enable you to make a conclusion. And there will be around 5 to 10 questions similar in nature. You have understood, what you have almost studied up to 5 to 10 questions, similar in nature. In a different way, they will ask. But as long as you understand the concept, that's good enough. There could be data like data types. I just told you, there are two types of data. There will be a simple question. This is what type of data, quantitative or qualitative? And you will be able to answer. So this is how, this. Let me show you, because I have been showing you so many. After that, I'll go for an easier topic. Don't worry. Yeah, I have got a very good, a very good project in dispensing, because I think Nadira suggested dispensing time because she's a pharmacist. Actually, we have done this project before in hospital. If you thought I was just making up stories, it's not like that. And many more projects we have done. As I said, I'll show you some of the things. Let me show you. I think yeah. Sorry for that. I was trying to search for that file. Yeah, this is the one. Yeah, this was the project done in a Saudi hospital by one of my students. Yeah, and it is a very long time ago, 2010. 2010, it's a long time ago. So all data is totally irrelevant. Yeah, and I have taken their permission to show this. Although I'll not be showing too much, because still it's not. I'll not be able to show or describe the things. But this is how a typical project is done. A data-oriented project. The dispensing time was 20 minutes, and now they want to reduce it 10 minutes. Everything is done in a project, so you are doing a project, right? See, systems thinking. After some time, I'll take you to systems thinking. So I'll skip that part because I have not yet, talked. I'll also talk about value added, non-value added, and I'll show you this also. But just now, I explained to you a concept of the data-oriented decision. Let me show you that part. See, first you calculate. I showed you a diagram, something like this. It is known as cause and effect diagram, also known as fishbone diagram, also known as Ishikawa diagram. So there are three names of this diagram, where you try to brainstorm on all the possible reason why there could be medicine like high. Why is this medicine dispensing time high? And then using different tools like Pareto, etc. I'll teach you Pareto also in a short while. Don't worry. But let me come to that. What I was talking about. Yes. Is profiler responsible for the time taken? We are using a box. Why? Profiler name is attribute. Number of items versus this. We are using a scatter plot. They thought that more the number of medicines, more time will take in. That's what they used to think. 2 medicines will take less time, 20 medicines will take more time. But unfortunately, when they plotted the data, they said there is no relationship. Two items or 20 items, it is the same. Scatter plot is telling you. I just wanted to show you that there are a lot of other techniques. I'll not go into the details. Okay, so if you are interested towards the end, I'll show you the whole project. But first, let us understand the concept. I taught you the concept. I also showed you the real, way of doing it. In fact, we'll do a project. In fact, I think there will be enough time. And if you are willing to stay, till the end of 2 hours, I will show you. We'll do a project together. Let me also talk about. Let us now come to the systems thinking I was telling. So systems thinking is a leadership. As a leader, quality leader, you have to think and believe in system thinking. What do you know by system? What do you mean by system thinking? System thinking means you should imagine your setup, your hospital, clinic, or whatever organization, institution you're working in, as a system. So imagine your hospital or your department or wherever you are working. You may be working in an institute, in a medical college. Think of your organization. There are certain inputs. Yeah, there are certain inputs. They are producing an output. I am drawing. whatever I'm drawing is applicable to all organizations in this world, all departments in this world. What happens? Typically, certain inputs, they pass through a series of process steps in different departments, and then finally you produce an output. A typical way of looking at from hospital's perspective would be output is the treatment here, right? Patient treatment. And inputs could be, can you tell me what could be the inputs? The patient treatment, I'm drawing the patient treatment process. So inputs would be the patient history, physicians, nurses, these are all inputs. Yeah. Patient history. Then you have your the physicians. And nurses. Yeah. These are the inputs. And then you have processes, triage, this, etc., examining the patient, analyzing the issues, and then, of course, giving the medicine, etc. So finally, a treated patient or a treatment is the output, which is, of course, for the patient, or I would say customer. Yeah. So please remember, this was a patient treatment process, so the customer here is the patient. But in a hospital, there are other customers like your shareholders. If you're a private hospital, shareholder of your hospital is also a customer. Government is also a customer. Government, the compliance process, from regulatory compliance. If I'm looking at regulatory compliance process, you have inputs, your documentation, etc., processes. And then you have a regulatory compliance process. Finally, compliance is the output. Customer is the government. I hope you are understanding. Please understand. So I'm drawing a model. The model remains the same. Whatever goes into these boxes will change depending on which process you are talking about. And obviously, the inputs are supplied by the suppliers of the inputs. Say, for example, patients are supplied by patient only, the society, you could say. History is the supplier of history is the patient. Supplier of physicians and nurses, maybe our HR department, you can say that. Or if you're external sources, then it could be external freelancing. And this is how our system operates. And you have got a strategy team or a planning team, strategy or planning team, or governing board. So customers would give you feedback about the output. Here, in this case, patient will give you the feedback about the treatment. Or government, if the government is the customer, government will give you feedback about your compliance status. And also you'll predict the demand. And based on that, your planning team will plan and ask the suppliers to provide the required inputs. Like, for example, if there's a pandemic, depending on the demand of the vaccines, you'll inform the suppliers to provide the vaccines. Yeah. And dealing with the pandemic would be the process here. And the society will be the customer. And the output will be, of course, the taking care of the pandemic. Means maybe developing herd immunity might be the output. So please understand, this model remains the same for every process in the world, for every organization in the world. Now, a person who thinks like that, we call it a systems thinking process. What opposite of systems thinking is silo thinking. What is silo thinking? Silo thinking is, I belong to department B. I am from lab. I don't know what's happening before, after me. I want whatever department I belong to. I belong to finance team, accounting team. I will complete my job, whatever is given to me, in time. I don't know what's happening before me or after me. This is not a silo. I'm in my own world. I'm in my own silo. We call it a silo thinking. And what is this thinking? We are all part of a huge system. We call it a systems map. We call it as systems map. Yeah. Okay, one more question was Dr. Yogita was asking. Sorry, I missed out. The last graph that you made, that what we should call this graph you are talking about. This is known as box plot. Yeah, box plot. And this one is this is negative. This is positive. That's what you were asking. Sorry for that. I missed out your question. And this is no relation. Sorry, no relation. No, that's a positive relation, negative relation, no relation. Yeah. Yeah. So sorry for that. I just missed out. And okay, now going back. So what is systems thinking? Leaders, if you are a true leader, you will first develop systems thinking and then tell your leadership also. If they don't have the systems thinking, then you have to propagate systems thinking, because system thinking will bring in process excellence. See, I'll give an example. Suppose process A is taking 10 minutes to complete, process B is taking 10 minutes, and D is taking 20 minutes and 10 minutes. Okay. So what will happen typically? The patient flow will get restricted here, and there will be a queue. We're going to work in process inventory, we call it. There will be a queue. We call it as a waste. Yeah, we call this as a waste in our process. Waiting time or committing mistakes, errors. These are all 7 or 8 wastes in our hospitals. So when you do systems thinking, think in terms of systems. Think about the whole. Don't think about the parts. Also, this diagram is also known as value stream map, by the way. Stream map. Okay. So if you are doing systems thinking, you will rather focus on this particular process rather than trying to improve A, B, C, D. There is no point in improving B. Let us say I automate B. This department, B's department head. He goes to some conference and he finds some AI automation is happening, and he automates his process, reduces this 10 minutes to 1 minute. As per quality professional, we would say he has wasted companies' money by automation. Because the customer, here in this case, if the patient, in this example, customer will not feel any impact. What will happen? 10 completes 10 minutes. B just takes now 1 minute, finishes the job and gives to C, and C, the unit here in the patient will wait in front of the C workstation, we call it. Like C could be the billing process. D could be meeting the doctor or seeing the doctor. Examination. So we have to find the constraint. Where is the problem? And that's how. So as a quality professional, you have to have a system thinking. That's what. There's a lot of things. I'll not go into the details, but systems thinking you should have. Now, CPHQ will not ask you too many complicated questions, but when we are teaching you, we will teach you everything in so much detail that you are able to answer every question very easily. Because if you don't know the concepts, you don't know what is systems thinking properly, you'll not be able to answer the questions related to systems. Now you can answer all questions related to systems thinking. Okay, so this is how system thinking is all about. Let me touch upon, I think, a little bit more of. So system thinking is a discipline for seeing wholes. It is a framework for seeing interrelationships rather than the things. for seeing the patterns of change rather than the static snapshots. System thinking emphasizes circular feedback rather than linear cause and effect. Circular, you saw the circle, it's a value, how it's a whole circle, right? Not like I completed my job and there's a video, I'll not play that video, I'll rather give you the link. There are leadership, 5 levels of leadership. So maybe my team can put that video here. I've spoken about 5 levels of leadership. What are those 5 levels? Today, maybe I'll speak more of. Okay, you tell me. You want more of data analytics part today, or you want a balance? You tell me. Accordingly, I will decide. Yeah. Okay, so some people are telling analytics, some people are telling balance. Okay. Now how to balance. Okay, what I'll do. Anyway, this leadership, it's a very, very good video. 5 levels of leadership. This is, let me give the link to this video. Please watch it at your leisure. It talks about the different types of leadership, which you should be aware of. Okay, okay, some people are writing balance, so let me play this video, not to worry. Let me do that.
If your actions inspire others to dream more, learn more, do more, and become more, then you are on the path to becoming a great leader. In this generation where technology has become so advanced that it is available to everyone, the only competitive edge a company can get is by improving its leadership. How important a good leader is can be explained using the examples of many companies. Sure, all of you have asked this question to yourself at least once. Just how a parent shapes the characteristics of a child, or just how a teacher builds the foundation for her students. A good leader sets the benchmark for the company and its people. With good leadership, a company can grow and achieve its goals, at the same time create a healthy environment for its employees, thereby improving employee efficiency. A team can grow only up to the level of its leader. It cannot go beyond it. So the level of the leader decides the performance of the team. We now know that leadership is important. So how do we inculcate good leadership practices? Let me tell you about John Maxwell's 5 levels of leadership. The first level is position. This is the lowest level of leadership. As one can say, it's the entry level of the leadership. The position is the only level that requires no effort to achieve. One can simply be appointed at a leadership position. Now, there is nothing wrong with having the leadership position. However, relying only on this position to get people to follow you will not take you far. Position does not directly result in influence. You should use this level as a place to invest in your growth as a leader. This time can be used to learn to lead yourself through priorities and self-discipline. Level 2 is permission, which is based on relationships. Here the people choose to follow you because they want to and not simply because they have to. In simple terms, at this level, people give you the permission to lead them. If you want to grow at this level, you will need to learn to know the people you are leading and connect with them. If you treat your people as individuals who have their own values and beliefs, you begin to develop a positive relationship with them. Trust grows, mutual respect increases, and the work environment becomes positive and happy to work in. This is the level where solid, lasting relationships are built that create the foundation for the next level. Level 3 is production. In life, there will be times when people hit rock bottom and they feel there is no way out. This is when true leadership comes to rescue. Great leaders know how to motivate people. Getting things done is what level 3 is all about. To build influence and credibility, results must be visible. If you want people to follow you, not only because of your relationship with them, but also because of your credibility, then you must give them something to prove your worth. This is the level where leaders can become change agents. The more output you give, the more you will be able to tackle tough problems. Work becomes fun as everyone is moving together and the team rises to another level of effectiveness. Level 4 is people development. To sum up level 4 in one word, it can be called the reproduction level. A great leader is not someone who rises on the top alone. A great leader is someone who produces more great leaders. Your goal at this level is to identify and develop as many leaders as you can by investing time and effort and helping them grow. When there are more great leaders, the organization will accomplish more. By doing this, you are giving your people another reason to follow you. When they see what you have done for your team members personally, respect, trust, and admiration increases. And level 5 is pinnacle. This is the highest level of leadership, which also makes it most difficult to attain. You simply cannot reach level 5 unless you are willing to invest your life into the lives of others. But if you stick with it, you may find yourself at the pinnacle. Level 5 leaders develop level 5 organizations. They aim to create opportunities that other leaders don't. They create a legacy in what they do. People follow them because of who they are and what they represent. As a result, level 5 leaders often transcend their position and even their organization. One thing you must note here is the goal of John Maxwell's 5 levels of leadership is not to advance from one level to another, but it is to build upon each level. I would like to end with a very famous quote by John Maxwell. Leaders become great not because of their power, but because of their ability to empower others. Stay happy and keep learning.
Happy learning. Thanks for taking out time to watch this video. To learn more, check out our other videos. Link is given in the description below. Subscribe to our YouTube channel and have a great day. For more information you can write to us on inquiry@anexas.net.
Okay, so that was a little bit of leadership. Now let me take you through the topic of a little bit lean, not so much of analytics, but something related to process improvement. See, typical hospital environment is about high volumes, high variety, high variation, high speed, high stress, high turnover. And it is highly regulated. It is one of the most regulated industries, by the government. And it leads to lots of services breakdown, wasteful resource processes, and medical errors. So let me talk about the wasteful processes in this short period of time. And after that, I'll go to the data analytics part, because some people had asked for data analytics also. So I'll take you there. But very quickly, let me take you through this process improvement part. See, lean is about war on waste. So there are lots of waste present in our hospitals, and we are not aware. We are not talking about the waste which we throw in the dustbin, but we are talking about the waste which is present in our processes. So as a CPHQ professional, you should be aware of it. You should be developing an eye to see the waste in our processes. So there are different types of waste which is classified into waste of intelligence, waste of error, defects, rework, waiting, inventory, motion, transportation, overproduction, overprocessing. I'll just give some examples. Maybe it will help you because of shortage of time. I can't go into the details, but I think examples will help you to understand. And please understand that when we are talking about the waste, some of the wastes are very obvious, but a lot of wastes are hidden. So they are all hidden waste. Like, for example, when you are looking or doing a process analysis, when you're trying to improve a process, first you will map the process. And also you will do Gemba investigation. Gemba means go to the field, go to the place of action, watch how the process is being performed. And then, let's say, for example, this is a typical blood test processing and the time is given. We identify any process which the customer, here in this case, patient, is not willing to pay for. Think from customer's perspective, not from your perspective. Like walking to the OPD. Now, it is of no value to the customer. We call it as non-value added activity. We call it as waste. Registration in OPD. Now, from patient's perspective, it is not adding any value. Please remember, you have to think about value from customer's perspective. Why is the customer coming for a blood test to the lab? Because the value he wants to get is, he wants to maybe know the status of his health. Now, registration is not going to help him. So it is treated as non-value added activity. You'll be surprised to know, but that's how process analysis is done. So this is a non-value added activity, non-value. Let me tell you, there are only 2 value added activities. Remaining are not adding any value. Does it mean we should stop doing it? No. But at least we should know that they are non-value added activities and we need to reduce them as much as possible. So in such situations, in many hospitals, we have eliminated the walking to the OPD. We have eliminated the registration process also. We have done, and lots of good projects have done by our participants of our training programs. In many hospitals, we are consulting also. By the way, if you want consultancy from us, if you are doing an improvement project, if you want remote consultancy, you can always contact me. And we have a team, very good team as well, who will guide you in doing the projects. And apart from, I'm talking about CPHQ. CPHQ, of course, is an online training which we conduct. The online training is conducted, to make you learn all the things so that you pass the examination. But apart from that, we also do consulting and also in-house training. If you want to conduct these CPHQ trainings in your hospital for a group, I'll be happy to do that. Plus, not only that, if you want Lean Six Sigma in your hospital, we also conduct Green Belts and Black Belt training programs, as we have already told. So now let us look at waste of intelligence, example of waste of intelligence. Now, 80% of the nurse calls from inpatients were housekeeping in nature. My pillow cover is dirty, my bed sheet is dirty. These are all, patient. The nurse is not there to, look after these housekeeping issues. But you will find that they keep calling nurses for that. That's waste of the intelligence of the nurse. Otherwise, nurse will forget to give you the medicine. So that's important, that these are identified as waste, and try to reduce that, by educating the patient side in the beginning. Similarly, by eliminating a lot of waste, we have doubled the cardiology lab capacity. These case studies are given here, but I'll not be describing them. But overall, lots of things like signatures, approvals, they are not adding any value. But you'll find 5 signatures, 10 signatures, multiple approvals, approval after approval, taking what can happen in just 1 hour, it takes 5 days. This is again waste. What is that approver doing? What exactly is approving? Can it be automated? Can the decision be delegated? And we did that because we have a typical tendency of putting some checking, inspection, just like that. So try to reduce this waste as much as possible. Some other ways, this is a typical patient flow in our hospital. And if you see, let me very quickly, let me give you some examples of waste. Unnecessary process or motion, like searching time. We actually, in National Healthcare Service in UK, we eliminated the doors which was there in the lab. There are a lot of reagents, chemicals in the lab. they should have doors. We remove the doors so that people can see what's there inside. And the opening the door and closing the door itself, that few seconds saved cumulatively, were a big, huge saving for the hospital and for the lab. So there are so many other examples. A person who's not utilized is a waste, and a person or equipment which is not utilized is a waste. And overutilization is also a waste. If you overutilize a resource, a person, or a equipment, it will, it will lead to errors, defects. Cost of a 5-minute MD walk, calculated $6, or in a lighter vein, walk to elevator 1 minute, walk elevator wait is 3 minutes, elevator travel is 1 minute, walk to lab or pharmacy is 1 minute, nurse cost per hours something. And then if you do all these calculations, you'll find that cost of elevator wait per day per nurse is $12. And if you have 200 nurses multiplied by 365 days, it may run into some $1 million or so, more than that. So these are some examples, which there's another tool called concept called reducing the errors. We have Pokayoke. Pokayoke means even by mistake, cannot commit a mistake. So something like, identifying the medicines which are looking similar in nature, or indented surgical instrument tray, and also making a hospital visual hospital so that people don't keep asking questions. It is also considered as waste. The patients are asking questions, and then your staff is answering those questions. Why to have that? Make the hospital so visual that they don't have to ask questions. They can just get the instructions visually. The Pokayoke concept I was talking about, Pokayoke means mistake proofing. Pokayoke is a Japanese word. Yeah. It knows mistake proofing. So some of the examples, let me say, oxygen, nitrogen cylinder. They cannot fit into, like, the connections of oxygen and nitrogen cylinders are such that you cannot fit them into each other's lines. The fittings are different for oxygen line and oxygen cylinder, nitrogen line, nitrogen cylinder. So, by mistake also you will not put them into, interchange them. This is an example of Pokayoke, mistake proofing. So think of mistake proofing. Other examples of Pokayokes are fixed numbers of packages during surgery, complete catheter kits for insertion. So these are all different examples I was just talking about. And these are all lean concepts. As a quality professional, you should promote these within your hospitals. And of course, you are taught about these and you promote. Now, I was talking about the data. So one of the things I promised you, data analytics also I will do, because some of you would like to have data analytics. So data analytics, let us going back to the data, and let's learn a little bit more about data. See, you can't improve if you cannot measure. And you can measure everything. Now, how can you measure? So I already spoke to you about it. There are two types of data, continuous data and attribute data, or quantitative and qualitative data. So you can measure everything. So if you go back, if you go back to your systems map, so your customer, here the patient maybe, you want to make them happy. Customer is always looking for value from your output. Now, output could be a service or a product. Yeah. Now, how does the customer make a judgment about your output, about your treatment? There are certain measures like waiting time, errors, infection rate, yeah, and so on and so forth. There's so many measures. And you always have a specification limit set by we call measures and measures and the specification limit, if I combine together, you call it as KPI. There's a word for KPI. Waiting time should be less than 15 minutes. Error should be less than 2 per month or week, depending on the hospital and nature of your job. Infection rate should be less than X percentage. These are the measures, and these measures actually measure the extent to which the customer is being served or satisfied. So customer, overall, if you ask the satisfaction, etc., it is getting influenced by these measures. And if you're not performing well, like suppose waiting time is not 15 minutes, but 20 minutes or 30 minutes, you will do an improvement project. Okay. So the data you have to collect. Now, data is of two types. I told you all the measures are either continuous data or attribute data. Okay. So quantitative or qualitative. And I have already informed you, here was an example. So change of shift, yes or no, was qualitative. And change of, let's say, medicine dispensing time was quantitative. It is a numerical value. It could have a decimal place also, right? So depending on the data, there are two types only. There is no other third type. And depending on this data, you can analyze this data. Yeah. When you are just looking at a simple medicine dispensing time, okay, any continuous data, if you're looking at, and you just want to make a judgment, a graph about only the medicine dispensing time, it is quantitative data, right? Quantitative data. I told you there are quantitative and qualitative, also known as continuous data. Continuous, this is known as attribute data. Yeah. So quantitative, qualitative, continuous, and attribute. Two types of data. Okay. By the way, I have got Arabic videos also. They are listed. They are very much, those many of you know Arabic, I think. So you can join. I've got Arabic videos of our process excellence, and let me show you a glimpse of it. I'll just maybe 30 seconds. After that, of course, I have used AI to translate all my training programs into this thing. This is here I'm talking about the types of data, right?
الثالثة: إذا كنت تعتقد أن شيئا ما لا يمكن قياسه، فمن المحتمل أن تكون بيانات السمات. الآن دعني أخبرك كيف يمكنك قياس أي شيء. هناك نوعان من البيانات: البيانات المستمرة وبيانات السمات. يمكن
I'm not sure whether how much good the translation is, but people tell me that they at least understand the concept.
تمثيل البيانات المستمرة على خط الأعداد. يمكن أن يكون لها منزلة عشرية، ويمكن أن تحتوي أيضا على وحدة. لنفترض على سبيل المثال العمر والطول. العمر 52.5 سنة، هذا هو عمري. طولي ربما 100.
Okay, anyway, so that was our, and let me go to the English now. So here, the same thing is in English too. And they're all available on my YouTube channel. You can just subscribe and to Anexas channel. So,
of a process 3.5 hours, or procurement time in an organization 120.3 days.
So these are all continuous data. And what about attribute data? Let us see that as well. Attribute data, always have categories. So I want to measure happiness, let us say. Many times you feel I cannot measure happiness. So there are so many things. I cannot measure feeling, I cannot measure satisfaction, pain, etc. So you can create categories. And once you create a category, like for example, I can create in my hospital, how many people are happy, how many people are unhappy, and my staff. And I find that 60 people are happy, 40 are unhappy. So what I'm doing, I'm counting and then creating proportion of happy people and proportion of unhappy people. So whenever I want to measure happiness, I will measure in terms of categories. I'll make a count, create a count, and then I will create a proportions. Proportion means portion out of one. Like if there, let's say, proportion means this circle is 1. So this is 0.6 and this is 0.5. And it's such a short time, I can't explain all these concepts to you. But just I'm trying to give you a very, very brief overview, very, very quickly, as much as possible. Now, when you are dealing with attribute data, you graphically, you will make pie charts. We call it pie chart or bar chart. Like, for example, 40 people are unhappy, unhappy, and this is happy. So when you are dealing with attribute data and you want to display, you will use either bar chart or pie chart. Okay. When you want to display continuous data means this one. Like waiting time, you will make a histogram. Something like histogram. So when you have continuous data like waiting time, you will find, you collect the data, waiting time, like 10 minutes, 20 minutes, 15 minutes, 30 minutes, 35 minutes, 45 minutes, 20 minutes, 35 minutes. So you'll find most of the time, you'll find a center average. Most of the patients are waiting for 30 minutes. Some patients are waiting for, let's say, 20 minutes. Some patients are waiting for 10 minutes. Some patients are waiting for 40 minutes. Some patients are waiting for 50 minutes. Some patients are even very few wait for 60 minutes. And very few patients don't wait also. But such patients are very few. Okay. So this is called as histogram, a frequency chart. So when you are dealing with quantitative data, you will make histogram by collecting the data. When you are dealing with attribute data like happy, not happy, satisfied, not satisfied, you will make pie charts. Let's say very, very happy, let's say neutral, and unhappy, and extremely unhappy. So there are 5 categories I've done. So pie chart or a bar chart. So depending, and these are the only charts. Histogram, pie chart, bar chart. The other one, oh yeah, that also I told you. If there are 2 continuous data, I want to see the relationship. See, here I did not want to see any relationship. I just wanted to make a comment about our waiting time or comment about our patient satisfaction. So you are just making a comment about your existing process or a measure. You will just make histogram for continuous data, and or qualitative data, you will make a bar chart. Yeah, attribute data, bar chart or pie chart. But if you want to see the relationship, whether my waiting time is affected by the, let us say, examination time, maybe by the doctor, or meeting time with the doctor, then both are continuous data. You will make, so time spent with the doctor or waiting for the doctor. Maybe that could be doctor's waiting time, waiting for the doctor, and total waiting time. I will make a scatter plot because both are time, both are continuous data. Total waiting time versus department. Which department is affecting? So this is attribute data. So I'll make a box plot. So let me show you. Now don't worry. I'm just showing you maybe very quickly a project. And I'll do this project for you so that, you see how the quality tools are applicable. Now, I'm not teaching you anything, but demonstrating, because this is more like When you come to my session, I will teach you these tools and techniques so that you can answer all the questions. So let's say I want to reduce the patient discharge time in the hospital. Now this is at continuous data. Yeah. So I can make a histogram. I'll say, well, let me see how the patient discharge time is distributed in my hospital. And I'll get an average, I'll get a standard deviation. We teach you what are these terms or how to calculate. They will not ask you any question in doing calculations. Please remember, they will show you a chart. You have to draw the proper conclusion. Okay. So this is what average and standard deviation is. Very easily nowadays you can get in Excel sheet also. Please remember, they will not ask you to do any calculation. They will show you a chart. You should be able to interpret. So we'll explain everything to you so that you are able to get the interpretation. So I'm showing you something very, very quickly without much explanation right now, just to give you the brief hints that it's very easy. Don't worry about the data analytics part. Like here, they used a tool called cause and effect diagram, Ishikawa diagram also. Ishikawa said that if you brainstorm on man, machine, material, method, measurement, think of these categories, and think of what related to man is impacting your whatever you are trying to improve. Here you are trying to reduce your patient discharge time. So you can brainstorm on all the possible causes against these categories. And if you can do that, you can easily make something called as cause and effect diagram. Yeah. I see. I'm showing you in a software. They'll not ask you anything about software. Just to speed up, just to give you a bigger understanding, I am telling you. Yeah. So don't look at what I'm doing, but we'll learn what is a cause and effect diagram. They will show you a cause and effect diagram. They will just ask you what this diagram is called as. So answer will be fishbone diagram or a Ishikawa diagram or something like that. Another tool which is also known as Pareto analysis. Pareto analysis means, see, Vilfredo Pareto was an Italian economist who found that 80% of the money or wealth was with 20% of the people in Italy. And the same concept is called as 80-20 rule. 80-20 rule means, when applied to quality, means this is your problem, whatever problem you're facing, waiting time, infection rate, and like whatever. You will have lot of factors, lot of causes here. We also call it X factors, causes, many causes. 1, 2, 3, 4, 5, 6. Let's say there are 10 causes. So 80-20 rule of Pareto states that 80% of your problems are just due to 20% of your total causes. So out of 10, 20% means 2 are responsible for 80% of your issues. 80-20 is applicable, like if you remember, you can think of it. Suppose you are treating 10 diseases, let us say. You'll find that 80% of patients are coming for 2 diseases only. Yeah. This is just an example. So 80-20 rule, Pareto principle. So I'll just show you. So reasons for delay. If we apply Pareto principle, reasons for delay. So we collected the data. Why the delay is there? Discharge summary delay. So many things are there. So many things are there. Some causes will occur again and again and again, multiple times. So if you put and ask how many times each cause is occurring, if you count, you'll find some causes are occurring more, some causes are appearing less. If you put them in descending order, yeah. So I'm just showing you demonstrations. In our class, we learn all these things very slowly, but I'm just quickly showing you. So it will tell you how many times, which are the biggest reasons. Reporting is not accurate, staff is not available, pharmacy delay, discharge summary delay. These are the top 4 reasons contributing to 80%. The first one is contributing 30% of the time. Second person is contributing 25%. First two together, 29% to 25%. Add them together. You get 80% is being contributed by the first four. So focus on these four, top four, and you will solve your 80% of your discharge summary. Discharge, so patient and discharge summary is a big problem. Is it a really big problem? Okay, you can further analyze I think you, so if I want to know patient discharge time and discharge summary delay, are they really correlated? Is that a root cause? Discharge summary delay, is it affecting my discharge time? Both are continuous data. I can make a scatter plot. And I'll make a scatter plot. And when I do a scatter plot between the two, but see, I'm just trying to speed up the thing. I'm showing no one is going to ask you any question about this, the way I'm doing it. Yeah, please understand. I'll teach you the tools and techniques. Like here, sorry, yeah. So here, patient discharge time and patient discharge summary. Is it delay? Is it impacting? It appears it is impacting. More the discharge summary delay, more the discharge time. So that appears to be a root cause. So see, in the exam, you will just get this graph. That's it. You will be asked, is discharge summary delay in this hospital a root cause of the discharge time, high discharge time? And your answer is yes. Now, if I ask you, is pharmacy delay root cause of discharge time? Let me ask you by showing you the data and showing you the graph. Oh, here it is not. The pharmacy delay is not responsible for high discharge time. As simple as that. Similarly, is discharge time getting affected by reporting accuracy? Reports are not accurate. Is it impacting in the hospital? Well, let's see. Here I'll do a box plot. Because reporting accuracy, correct or incorrect, is attribute data, qualitative data. This is quantitative. Discharge time is quantitative. So I'll do a box plot. And reporting accuracy, accurate reports. So when the reports are not accurate, there's an error. Incorrect, it takes more time. Correct reports, they get replaced. So accuracy is an issue. Let me improve on the reporting accuracy. Reporting errors should be reduced so that my discharge time will get reduced. So all these things, I think, sorry for the speeding up the whole thing towards the end, but these are all techniques. And if you are interested, let me tell you how you can, there are many, many improvement projects you can do, like, for example, waiting time, patient waiting time, you can reduce it. First, do your systems map, supplier, input, process, output, customer, have a process view, and then display the chart, how this waiting time is looking like in the hospital. What are the reasons for the waiting time? Then what is the top 2-3 reasons, top 20% of the reasons? And then you take an action on the root cause. And that's how a typical project will look like. So these charts and graphs around many questions, I said 60% of the questions are related to data analytics. I covered quite a bit of that. And if you are appearing for the exam, you will definitely, and if you definitely, it will help you. And if you are interested in joining my course, my team will tell you the dates. I've got, you can join my course anytime. My team will give you the information here. You can register if you are interested. Let me ask you how many of you are registered. Poll, we can ask a poll. So if you are interested, just can you put a poll sharing? Ending poll, right? Let me choose this, right? So do you believe that CPHQ certification will help you in grow in career? See, even if you are not going for CPHQ certification, exam, some people say, I don't want to write exam and etc. because it costs money. So $500. The exam, I'm talking about the exam. They just do the training and they learn the tools, techniques, and they improve the process. They get lots of promotion, right? Okay. The next one, let me choose. Yeah. Do you feel more confident about attempting the CPHQ exam after this session? Yeah. If you can just answer this question. Yeah. So many of you are saying, yes, I feel more confident. And some people are telling need more support. Yeah. So no, don't, of course, we are there to support you. You can also follow me on LinkedIn. And if you want to join my sessions, I conduct the sessions, and please join those sessions. Can you please? So, would you be interested in receiving updates on our future training sessions or full CPHQ courses? If yes, I'll be happy to send you those details, and you can join my sessions. Usually, we are conducting session on a Saturday whole day. Uh, you know, typically around 6 hours or so, 6.5 hours, morning till afternoon. We do these sessions, and we'll be happy to send you the details about this course. Those who have already answered, I think most of you have said yes, so I'll be happy to send you this. And the dates, if you can just publish the dates, please. So the dates are given here. Can you please blow it up, make a full screen? My team can do that. Yeah. So these are Saturdays. Our next batch is starting on 26th. And if you are not able to join that, another batch is August 30th. So 26th July is our next batch, and the 30th August is another batch. And also, if you join our session once, you can join our session multiple times, totally free of cost. Means only pay the fees once, and once you pay the fees, you can join our session 2 times, 3 times, 5 times. You can revise. Some people, take even after finishing the CPHQ, they want to revise. After 5 years, they come back to our sessions. The second time is totally free. Any number of times you can attend our sessions. And we'll give you all the recordings of the sessions, all the discussions, plus, of course, live sessions. You can join anytime. So these are the timings for our sessions. And please register yourself. You can always, there is a registration link my team will provide you. You can pass the CPHQ in the first attempt conducted by NHQ. And I'm Amitabh Saxena. My team has put a well-known name in CPHQ world. Okay. Okay. And I think that's anyway, whatever it is, I'll be a little humble there. But my team has put in that it's a, I don't know how many people know me. But anyway, it is a good training. I will teach you properly, that I can assure you. And we have a customer support 24/7, anytime, and lots of mock questions we'll be giving it to you. And a lot of guidance we'll provide you as we conduct training programs. So your question answers, let me check. Yeah, Q&A. So the last graph that you have made, what we should call negative skirt. Okay, that's, I'm not, okay. Okay, the graph that made with the green color, that will be the name of the kind of graph. That is, okay. That was also scatter plot, but there is no relationship. So positives, you see, all the 3 were scatter plots. Okay, let me show that as well. I will answer that question, not to worry. But these are all the other details. Let me just complete this part. So I'll answer your question after this. So you can apply today. You can also get a certificate. You are preparation steps to apply for CPHQ certificate. You can get get a certificate. You are also receiving a certificate for today's training, and you have attended an introduction to CPHQ, because you did spend some time. So there's a original course fee of 1,500 dirhams or reals, and you can register. If you register today, you'll be getting a discounted fee, and we are usually conducting this our CPHQ training programs. Every month we have one batch, but try to attend it as soon as possible, so that you can, again, if you're planning, even if you're planning to appear for an examination, maybe after 6 months, your preparation can start from today. So go ahead and register yourself. Some of you are interested in only the improvement projects related training programs. We do conduct green belt and black belt training programs also. You can join that programs also. There's a combination also, like if you want to become a black belt with CPHQ at a very, very huge discounted fee, the other program almost comes to you for free. So you can also join those sessions. And plus, I can assure you, my personal attention is there, given to every individual. And also, you can write to me anytime, because I'm doing this full time, conducting training programs. So most of the time I'm either consulting the hospitals or I'm free. Not every day I'm consulting. So I will be happy to reply back. Or I have a team also, a team of excellent healthcare professionals, data analytics professionals, and they'll be happy to reply back to you. These are other upcoming free webinars. You can attend or pass on the information to your friends also. We need your support because we don't have any huge budget. We are not a very big company or so. We need and rely on your word of mouth publicity. So if you know any of your colleague who's interested in learning about quality, anything related to quality in healthcare, feel free to connect them to us, and we'll be happy to send all the details to them. So with that, I think let me answer the questions now. So one of the questions, if I have understood correctly, was the question about the graphs. Yeah. So you are talking about these graphs, right? Yeah. Yeah. So these all three graphs are known as scatter plots. All the three graphs. This is 2 and 3. All the three graphs are known as scatter plot. But the interpretation, this scatter plot says there's a negative relation. This scatter plot number 2 says it's a positive relation. And the third scatter plot says there is no relation. Yeah. So all three are known as scatter plots. And they also, I did not talk about it. We also learn about regression. There's a line going through that. That's known as a regression line. So this is the regression line for this is the regression line for this, and there is no regression line for this, the third one. Okay, so I hope I have answered your question. That's what you are asking, right? Again. Yeah, okay, you got the answer, right? Okay, fine. So these are all three. 3 are the scatter plots, and the 2 are the box plots. And the other one, which so we learned about, okay, let me summarize. So we learned about histogram. We learned about pie chart or bar chart. Yeah. And when do you use? This is continuous data. This is attribute data. Then we also learned about when you want to see the relationship. Both are continuous and continuous data. You use scatter plot. Scatter plot. And one is continuous and one is attribute. You use box plot. Let me draw these charts for you. Histogram looks like this. Pie chart or bar chart looks like this. Scatter plot looks like this. And box plot looks like this. Yeah. So, and these kinds of charts, these 4 charts, and one more. One more thing. I covered too many things today. So one more thing is attribute and attribute. This is called a Pareto chart. Pareto chart looks like this. I did not talk too much about Pareto chart, but I did a brief introduction. 80-20 rule, right? 80-20. 80% of your problem is due to the 20% of the problem. So we learned in fact, we learned every tool, but in our class, I'll explain this in detail so that you can answer the questions very easily. So we have covered almost 40-50 questions material today in a very, very compressed manner. So I would like you to invite to my sessions, and I'll be happy to see you in my sessions. And I've been doing this for quite some time. Like it has been now 2 decades, 20 years, I have been conducting quality-related sessions for healthcare. My wife is a pediatrician, so she forced me to. I was doing happily in the industries, more normally other industries, but 20 years ago, she told me that, healthcare would definitely be happy to see all these tools. And actually, she was right. In 2006, I started conducting those sessions. And I've always seen lots of enthusiasm from the healthcare professional in learning those tools and techniques. A lot of research papers I have published, again, using these tools and techniques. How did we reduce the so many things, I think I have guided personally more than 2,000 projects. When I'm saying guiding means I train the people like you, then you do the projects. I just guide you. That way, I think more than 2,000 projects have been guided. And also training I have conducted for, I've lost the count, but must be around 100,000 plus candidates, everyone included, yellow belt, the sessions like these, everything included. So my team is telling me to say all these things. You can join my sessions. Okay, I think with that, thanks for joining the session. And